It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today I have an email from Annette who says, "Hi Patrick, I wonder if you can give some advice. My husband has had a brainstem stroke. He has been improving slowly. However, he was placed in a nursing home. He had been there for 17 days. He developed a collapsed lung and chest infection. He was admitted to the hospital in April and chest had been treated. He had several infections while in hospital. He also has a PEG tube and he's getting feeds, and there seems to be an issue with the PEG feeding. He was not keeping the feeds down. So they put the PEG further down on the lower bowel, which he seems to be tolerating the feed now. He's now ready to go back to the nursing home. Now, when a PEG tube isn't working and feeds aren't tolerated, then often a PEJ tube is being used, which means the feeds are going into the small intestines, which is what's happened here. The doctor of the nursing home says he will not accept him back unless the family signs a peace document stating he is not to be admitted to hospital should he become unwell. We as a family have not agreed to sign this because everyone needs to be treated if they are unwell. The family have now agreed to palliative care because they say he has long-term medical issues and agreed to treat him at the nursing home, first should he become unwell before going to hospital. He also has a tracheostomy. I feel we are being pressured into signing this peace document. I don't believe anyone should be pressured into doing this. Am I right on saying this? From Annette. Thank you, Annette, for sharing your husband's difficult situation. I'm very sorry to hear that he had a brainstem stroke. I'm also very surprised to hear that he's able to go to a nursing home with a PEJ and a tracheostomy. Most nursing homes wouldn't know what to do with a tracheostomy, and therefore I'm also not surprised that they don't want to do anything for him. They see him as palliative care, meaning, if you keep him palliative care, they will remove the tracheostomy as soon as possible to let him die. Now, I'm all in agreement to not sign anything unless you want to sign something because you think it'll be beneficial for you and for your husband, right? If you don't think it's beneficial, well, then don't sign for it, right? It's also difficult to manage a PEG and a PEJ tube unless you have the skills and know how to manage PEG and PEJ, let alone a tracheostomy, because tracheostomy is an artificial and unstable airway and needs to be managed by critical care nurses 24 hours a day. It doesn't look to me like, they have the skills there, which once again is why I believe they're pressuring you for palliative care. Now, the next question is here, where to from here? You absolutely should get an advanced care plan here for your husband, and you should be documenting that he needs to go to hospital when they think he's deteriorating rather than him having treatment at the nursing home. Now, I'm all for keeping him at the nursing home if the right care can be provided there. But if it can't be provided, then he absolutely needs to go to hospital. Another idea here is for you to look at intensive care at home. You can find more information at intensivecareathome.com, because with intensive care at home, your husband can go home with critical care nurses 24 hours a day. That can also manage the tracheostomy, the PEG, and the PEJ, which again is not a common skill to have for people or for nurses in general. That's why we employ critical care nurses with a minimum of 2 years critical care nursing experience exclusively. Now, get an advanced care plan, get it all documented, what you want. Don't sign anything unless you think it's beneficial for you, your husband, and your family, right? And make sure he goes back to hospital if need be, and go and check out intensivecareathome.com for more information. You see, I've worked in critical care nursing for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can confidently say that we have saved many lives with our consulting and advocacy, and you can verify that by going to intensivecarehotline.com and you click on the testimonials section, or you go to intensivecarehotline.com and you click on our podcast section, and you can verify in the testimonials and in the podcast where we've done client interviews that we have saved many lives with our consulting and advocacy. And that's one of the many reasons why we created the membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, sharing all my over 2 decades worth of intensive care nursing experience with you, so that you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment, and so that you can influence decision-making fast. I also do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, Skype, whichever medium works best for you. I talk to you and your families directly. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my email newsletter at intensivecarehotline.com. Share the video with your friends and families. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.